Welcome to Perspectives, the vodcast of the American Mental Health Counselors Association with the National President and Interim CEO/ED, Dr. Beverly Smith. This vodcast will bring to you the perspectives of clinical mental health counseling as it pertains to ethics, public policy and legislation, multiculturalism and social justice, as well as leadership and advocacy. This vodcast will feature experts in the clinical mental health counseling field to enhance the work of clinical professionals and to inform the public. The American Mental Health Counselors Association advocates for over 130,000 licensed clinical mental health counselors in the United States who are licensed to assess, diagnose, and treat mental disorders. We are the only organization working exclusively for clinical mental health counselors. Join the Perspectives for insight from experts on wellness and daily living, current clinical research, integrative healthcare, as well as how to maintain personal, family, and organizational wellness in an anxious and ever-changing world. Let's connect and hear the perspectives.
Hello, I'm Dr. Beverly Smith, President and Interim CEO of the American Mental Health Counselors Association. Today on our vodcast called Perspectives, we have Dr. Aaron Norton with us. He is a Southern Regional Director for AMHCA, but he also wears many other hats, which we will delve into today. Dr. Aaron Norton, introduce yourself to our prospective audience.
Sure, and thank you for having me. It's awesome to be here today. I love that AMHCA is doing vodcasts, and I am a licensed mental health counselor and a licensed marriage and family therapist. I'm in the Tampa Bay area of Florida, and I've been an AMHCA member for many years, and have a tremendous appreciation for the work that AMHCA does to advocate for counselors. And I practice I have a small private practice, but I also work as the executive director of the National Board of Forensic Evaluators, a not-for-profit organization that provides certification and training for all mental health professionals who are pursuing specialization in forensic evaluation. And then I do a little bit of adjunct work at the University of South Florida. I've been licensed since 2009, but I got a really early start in our field. I was 20 years old when I worked in my first treatment program as a technician. And then I just stayed in the field the whole time, all the way through college and never left because it's a wonderful field to work in.
It's a great field, but you are a great resource in the field. I've enjoyed working with you as a Southern Regional Director. You are extremely active and hands-on with AMHCA, and you've allowed us to make and engage in collaborations that were good and fruitful for AMHCA, but also good for licensed professional counselors, licensed mental health counselors, and just others in the field. And that's what we want to talk a little bit more about today, for you to share with us when we talk about the National Board of Forensic Evaluators. We talk about how can individuals become certified? What are the benefits? And so talk with us a little bit more about your role with the National Board of Forensic Evaluators.
Sure. I guess I'll start with how I first got involved with NBFE. It was as simple as prior to even knowing that NBFE existed, I had been trained by my qualified supervisor in Florida to do substance abuse evaluations for the courts. And like a lot of people who do substance abuse evaluations for the courts, I wouldn't call the training, now looking back on it, I wouldn't call it as being formal training by any means. It was kind of like, somebody who did some of this told me some of the things that they do, and then I kind of replicated some things and then made some things my own, and it was sort of guesswork to a degree. And then in 2014, it was February 2014, I went to the Florida Mental Health Counselors Association annual conference, and I'd seen that they had a partnership with the National Board of Forensic Evaluators, and that they were doing a pre-conference certification workshop. And I thought, I have felt insecure about my forensic evaluation work, lacking maybe formal training in the area, but yet actually doing substance abuse evaluations for the courts. So I thought this would be a great opportunity for me to learn and see if I'm on track or not. And I went to that workshop, and to my own sort of horror, I discovered that there were a lot of things that I was doing in the forensic evaluation arena that really weren't consistent with the best practice. And I'm so grateful that I learned that some of the things that I was doing that could have become a problem down the road if I continued practicing that way in the forensic arena. I also got a lot of reassurance that I was on track with a lot of things, but it really helped to reduce the sort of anxiety about providing that kind of work, to have a good framework. And I was really impressed with how within NBFE, it sort of felt like a fellowship, not like a stuffy sort of impersonal certifying board out there, but people who work and practice in the trenches and who are very willing to mentor other people in the profession with the common goal of increasing the quality of work that's done in forensic evaluation. And so I was really drawn to that kind of personable sort of experience that was also challenging me and helping me to learn a lot. So I got certified, and then I started volunteering for NBFE. And at first I volunteered to be on their training committee and to chair their training committee. And then after a while, I was offered just a little bit of side work in an executive director role, which grew and became a lot more work as executive director over time. And I've not left NBFE. And one of the things I really love about it is that traditionally, the forensic evaluation arena has really been more an area for psychologists and psychiatrists. But even today, there are fewer than 400 certified forensic psychologists in the entire country. Wow. And so most of the psychologists who practice in forensic evaluation aren't certified. And in many areas in the US, there are shortages of qualified forensic evaluators. And there are also states where there have been lawsuits because people have been waiting too long, sitting in jail, just waiting for a forensic evaluator to be available. Since counselors comprise the largest percentage of the licensed behavioral healthcare workforce in the US, and there are so many more counselors than there are psychologists, and since counselors have some special expertise that actually lend themselves very well to some of the referral questions in forensic evaluation, it really makes sense that counselors should have a place at the forensic table, as well as social workers and marriage and family therapists. So that's how NBFE was born. It was born in 2003 because a licensed mental health counselor in Florida, Dr. Norman Hoffman, had been doing evaluations for the courts and realized nobody provides training and certification if you're a counselor, if you're anybody but a psychologist or a psychiatrist, and that there was a need so that people weren't doing what I was initially doing, which is doing an evaluation without having had formal evaluation training, but not in the forensic arena. And it's different. The forensic arena is different than the clinical arena, to say the least. So a need was met with forming this organization. And then it also became an advocacy experience for counselors who are interested in the forensic arena. So the work I do there is mostly administrative. I help to plan a lot of the training events. I'm one of the instructors for the certification workshops and handle a lot of the communications and help us to publish guidelines and also help out with the advocacy work when the ability for counselors, marriage and family therapists, and social workers to practice forensic evaluation sort of is being challenged anywhere in the country.
That is true. And so when you talk about advocacy, could you expand a little bit more on that advocacy piece and intersectionality with a certified mental health forensic evaluator and a licensed professional counselor, licensed mental health counselor?
Absolutely. There's kind of like two different fronts, I think. And the first one is about psychological testing.
Okay.
Now, for me, I was in my master's level graduate mental health counseling training, we were actually taught to administer tests like the MMPI as part of our core curriculum. And I had been doing testing, since I was a grad student. I'd been doing testing under supervision at least. And so then when I first started hearing that there are actually places in the country where people say that counselors don't do testing and that they're not qualified to do testing, it was a very interesting thing to me, especially when I open my own counseling textbooks. I see that it's ironic that the history of the counseling profession started in psychometrics and that we've always been testers since the early 1900s. So it was really an interesting idea. And then I even started doing things like taking the APA program requirements for psychologists, and then the KCREP requirements for counselors, and NASW, and or actually CSWE for social workers and so forth. And I started comparing, what do they require graduate students to learn? And what I came up with is that there is really no evidence that psychologists are required to get any more training and testing in their graduate level programs than counselors are. And in fact, in my own university, a state university, the University of South Florida, when I examined the specific coursework that psychologists in the APA accredited program take and compared it to the specific coursework that mental health counselors took, it actually looked to me like we got more training and testing and evaluation, surprisingly, because I would not have guessed that. Now, the scope of practice of counselors in most places includes testing, as well as counseling and psychotherapy. And when you compare our training to psychologists, we get more training in counseling and psychotherapy than they get, and they generally get more training in research than we get. Yet we don't try to keep them from practicing counseling and psychotherapy. We don't say, well, we get more training than you in that area, so you shouldn't be allowed to do it. But it seems like the reverse is true. It seems like in the psychology profession, some of the associations, at least in psychology, try to make the case that psychologists get more training and testing, and that because of that, counselors shouldn't be allowed to test. And that's a very interesting and, in my viewpoint, a hypocritical perspective. Because the things that social workers and counselors and marriage and family therapists get more training in than psychologists are also allowed to do, even though they get less training in it. It seems like a very strange position to take. And I think ultimately it's one that doesn't benefit the public.
It does. You said something earlier. You said everyone has a place at the table with doing this work. Licensed professional counselors, licensed mental health counselors, psychologists, psychiatrists, social workers. There are other human service providers as well, but I like that you said there's room at the table. There is enough work that needs to be done. There are a lot of people who need help and services. So we don't necessarily have to exclude, but we can more or less, be more inclusive to help people who are in need and to benefit the public and the community. So there's
absolutely.
I'm glad that you said that. So June the 10th is a important date coming up. You want to kind of announce or share again? I know we've had some announcements and you all have publicized the event on June the 10th, but let's talk about it. If you want to introduce it or share it with our audience again.
I'd love to. On June 10th, NBFE and AMHCA are having a certification workshop that's a virtual certification workshop. So that fortunately, counselors all over the country can participate. In fact, we also get participants from outside of the US in a lot of our certification workshops because the need is so strong for people who specialize in forensic evaluation. So it's Friday, June 10th from 10 a.m. to 7 p.m. Eastern time. We try to do that so that we wouldn't have counselors on the West Coast having to wake up at like 4 a.m. To attend a certification workshop. We wanted to be inclusive for counselors all over the country. So what this training will allow counselors to be able to do, it's essentially the same kind of training that I got in 2014 that got me started with NBFE. And we cover what is forensic evaluation, what are the ethical considerations unique to forensic evaluation? How is it different from clinical or therapeutic evaluation? And then we prepare people to take and pass the written examination and the oral examination to get certified as a forensic evaluator. We also talk about how people can build their resume to do forensic work. And we talk about some of those difficult issues, like what about the ability of counselors to administer and interpret psychological tests? And even if you can administer and interpret tests, should you be, and what should it look like when you administer or interpret testing? This isn't just about, we want to be able to do all things, but we want to be able to do things competently and ethically, and as well as abiding by the law. So that's what this workshop is really about. And it is an excellent opportunity, not only to learn about forensic evaluation, but also to pursue certification, because it is so much more difficult for opposing counsel in the courtroom to challenge whether a counselor is truly an expert in forensic evaluation if they've been certified, because then you've gone through a process that includes formal training, vetting of your credentials, abiding by ethical guidelines, passing a written examination, creating a sample report, defending it successfully in front of a committee of forensic experts for your oral examination. And even things like verifying malpractice insurance are worked into the certification process. So it's a really good opportunity to sort of be vetted and prepared to do that kind of work.
Now, if you become certified as a mental health evaluator, that's kind of a launching pad to other certification or foundation to be certified in other areas. Can you share with us the other areas in which you provide certification?
Yeah. So if you get the CFMHE credential with NBFE, you're also eligible for 2 specialty certifications, and we'll be adding some new specialty certifications in the future. But the 2 that we have right now, one of them is Certified Child Custody Evaluator, or CCCE. So this is a credential that goes above and beyond the sort of groundwork forensic mental health expertise into a more specialized area with some extra nuances that involves parenting and custody cases. So that is an option. And then a second option is the Certified Forensic Behavioral Analyst, or CFBA credential. This one's really interesting. It was developed in partnership with the former director of the Behavioral Sciences Unit of the FBI. And I was in the original cohort, and it is really more designed for forensic evaluators that now want to branch out and do some work that involves training and consultation, maybe with law enforcement agencies. For example, training law enforcement officers on how to interact with individuals who maybe have mental illnesses that they could encounter in the public, hopefully in ways that would increase the likelihood that everybody walks home safe that day. Or who might do some consultation work with schools on identifying signs that a student is in distress and could use some early intervention, or with employers on identifying similar signs among their employees. It's about prevention and mitigation of disasters that could be mental health related, that mental health experts could be very helpful in providing their expertise. So that's another credential. And then outside of NBFE, AMHCA actually has a credential option. Yeah. So hopefully everybody watching this will know that AMHCA has its own line of certifications. And if you didn't know that, you know it now. So you can go to the AMHCA website and you can check out those options. But one of those specialty areas is in forensic evaluation. And it's a little bit easier to get the AMHCA certification in forensic evaluation if you have the CFMHE credential with NBFE. But I also recommend getting that credential. And that's the Clinical Mental Health Specialist in Forensic Evaluation, I believe is the title for that credential.
So what is the difference between the two? Should one go both, or one or the other?
Yeah, good question. The way I look at it is I don't look at them as being competition credentials, but more like complementary credentials, because the CFMHE credential is some of the requirements to get the CFMHE credential are actually less than the requirements to get the credential with AMHCA, but some are a little bit more. Like, for example, with the CFMHE credential, you have to pass a written exam, you have to write a sample report, and you have to have that report defended in front of an oral examination committee. And that's not part of the process for the AMHCA credential. But the AMHCA credential requires more time doing forensic work than the CFMHE credential does. So in my mind, what would make sense then is pursuing the CFMHE credential to get started in the profession. And then you can feel like you're practicing competently and in accordance with good practice and with ethical guidelines. And then when you reach that certain point where you're now eligible time-wise for the AMHCA credential, go ahead and get the AMHCA credential. And the AMHCA credential actually has like they've built into the requirements that it's a little bit easier to get the credential when you have the CFMHE credential. It like waived one of the requirements to move forward. So I kind of view them as good complementary credentials.
Okay, well, that's good to hear. And so as we move into the training date on June the 10th, what would you say to encourage those who are listening to go ahead and register for that course?
So I'll give you a few reasons why I think it's great to work in the forensic arena. First of all, if you're already working in the forensic arena, then we don't know what we don't know, right? So prior to me going to the certification workshop, there were things that I was trained are okay to do that I later discovered are not really okay to do in the forensic arena and could actually lead to an expert being disqualified. I didn't know what I didn't know until I got exposed to that information. So if you're already doing forensic work, but you lack that really formal training and you haven't been credentialed, then there's a great reason to go. And it's sort of like, don't want to make a big deal out of this, but the Johnny Depp and Amber Heard trials. I didn't really watch the trials except for the expert testimony pieces. And what I saw was, some expert witnesses completely falling into the common attorney traps. They get hurled into an expert's direction and just playing into it and also doing some things that are unethical, that really don't adhere to ethical practices and guidelines. And then other witnesses, we're doing a pretty good job of adhering to good practices in the field. So you don't want to be one of those expert witnesses who doesn't even realize that what they're doing isn't a good idea in the forensic arena. Now, if you don't already do forensic evaluations, then here's why I think you should consider it. The first thing is society has a need for forensic evaluations. Judges, attorneys, law enforcement agencies, they're not mental health professionals. So the court systems and the legal system in general need mental health professionals very badly to provide our expertise on all of the issues and matters that courts have to contend with that involve mental health. And like I said earlier, there's so many areas where there are shortages of forensic evaluators. So there's a societal need, and it's really important for a society to have mental health experts working in the criminal justice sector. But a second thing is that it's a great way to sort of add an extra area, a branch to your practice. So let's say you're a private practitioner, for example, and let's say that you don't work with insurance and you only do private pay, and then there's like an economic recession or something, then you could see that your business reduces potentially. But if you also have forensic work added into your practice and you do that work, the courts don't rest. So they continue operating when there's a recession. They have to continue doing what they do, and they still need experts to testify. So it's a way to diversify your practice and add a revenue stream. In addition, it's also very lucrative. Frankly, it is generally much higher paying than clinical or therapeutic work is. And it's meaningful and it's impactful. Now, your role is very different in the forensic arena. So you're not there as an advocate for a person or a group or something along those lines, which is a different hat to wear for a lot of us. But you are there to be an objective evaluator. Your client in that arena is the truth. You're doing all that you can do to line up as many sources of information and data and to point you to a conclusion to answer one or more specific questions posed by the legal system as objectively and honestly as you can. So it's meaningful and impactful. It diversifies revenue stream. It's challenging. It kind of takes you to the next level, I think, in your practice. And hopefully you would enjoy it as much as I have.
I'm sure they will. We'll make sure that we provide the link again for registration. We know that it will be a very educational, rewarding experience for those participants. As we begin to wrap up our time together, any final words you would like to share or say to our prospective audience?
Yeah, I guess I'll say this. In many times, the ability of counselors to provide quality work will get drawn into question. And I think if you work long enough in the field, you'll see examples of it. Mm-hmm. Like literally the founder of the National Board of Forensic Evaluators, Dr. Norman Hoffman, who's been doing forensic evaluation since like the 60s and is quite an expert to say the least. Just a few years ago, an attorney filed a motion saying, first of all, the attorney said Mr. Hoffman instead of Dr. Hoffman, like as though his doctorate doesn't count, but he calls the psychologist doctor. Mm-hmm. And then he says, Mr. Hoffman is a licensed mental health counselor and a licensed marriage and family therapist. Therefore, he's not qualified to conduct the type of psychological testing that is needed for forensic evaluation work. And so the attorney motioned to have him disqualified as an expert. And instead, the psychologist, who apparently the other side had hired or something, should be the qualified expert in this case. Well, it wasn't hard to defeat that motion because in Florida, it is very clear that any licensed counselor who has the appropriate training and is competent to do so can administer and interpret psychological tests. And so it's not like it was successful, but it's just a great illustration about how constantly there are efforts that are being made to try and sort of continue to feed or support this myth that because you are a licensed counselor, you are less than, you are inadequate, you are not skilled enough, you are not good enough to do certain things that counselors get training in and have been doing since the early 1900s. So I guess one message I'd like to leave with you is to not feed into the you are not good enough mentality. Now, I'm not saying that if you're not competent in an area that you should practice in that area. I'm saying the opposite. You can get the skills and the expertise and the training and the certification to be able to do the work that you are passionate about doing and to do it with great quality and to the service of the American public.
Awesome. You have a wealth of knowledge. As I said before, you're just an awesome resource. You have done great work with the National Board of Forensic Evaluators, as well as with AMHCA. So thank you for all that you do, Aaron. Thank you for just being a great resource and a great colleague to work with on the national level of AMHCA. So thank you for all that you do. We look forward to seeing everyone on June the 10th for training so that you can be a national certified forensic mental health evaluator. Thank you all so much for joining the Perspectives. Again, thank you to Dr. Aaron Norton for being our special guest today on Perspectives.
Thank you. Thank you so much.
Thank you for joining the American Mental Health Counselors Association Vodcast with President and Interim CEO/ED, Dr. Beverly Smith. We hope you will join us for the next episode to connect and hear the perspectives from experts and the organization that exclusively represent clinical mental health counselors. Be well.